the alarming surge in alcohol-related deaths in the UK, reaching a record high of 10,473 fatalities in 2023, demands immediate and decisive action from the government. This stark reality, unveiled by recent statistics, paints a grim picture of the devastating consequences of excessive alcohol consumption, highlighting the urgent need for comprehensive intervention strategies. Health experts are vehemently urging ministers to implement robust policies to curb this escalating public health crisis, with minimum unit pricing being a key area of focus. The Alcohol Health Alliance, AHA, a powerful coalition comprising 60 medical groups, charities, and treatment providers, has voiced its profound concern over the government's inadequate response to this escalating problem. Professor Ian Gilmore, chair of the AHA, expressed his deep disappointment, stating, "Today's figures paint a bleak picture of the ongoing harm caused by alcohol across the UK. It is unacceptable that, year after year, we continue to see alcohol deaths rise while action from government remains woefully inadequate." His words underscore the collective frustration and urgency felt by healthcare professionals witnessing the devastating impact of alcohol-related mortality. The scale of the problem is further emphasized by the rising number of individuals consuming alcohol at hazardous levels, exceeding the recommended 14 units per week set by UK chief medical officers. This alarming trend, highlighted by Alcohol Change UK, underscores the escalating health risks associated with excessive alcohol consumption. The consequences are far-reaching and devastating, encompassing a wide spectrum of health issues, from relatively mild ailments like headaches and sleep disturbances to life-threatening conditions such as high blood pressure, anxiety disorders, and various cancers. The long-term health repercussions of excessive drinking are substantial and significantly impact individuals' quality of life and longevity. A stark gender disparity is evident in the statistics, with men exhibiting significantly higher rates of alcohol-related mortality than women, more than double, in fact. This disparity reflects a long-standing trend and warrants specific attention in targeted interventions. Geographical variations further complicate the issue, with Scotland and Northern Ireland recording higher rates of alcohol-related deaths compared to England and Wales. Within England itself, regional disparities are pronounced, with the Northeast experiencing the highest rate, 25.7 per 100,000 people, while the East of England reports the lowest 11.5 per 100,000 people. These variations highlight the need for regionally tailored strategies to address the unique challenges faced by different communities. Dr. Katherine Severi, chief executive of the Institute of Alcohol Studies, delivered a powerful statement in response to these statistics. "We've seen record-high deaths from alcohol in the UK every single year since the pandemic. This simply cannot become the new normal, so the government must make tackling alcohol harm a top priority in 2025. Her words encapsulate the shared sentiment among health professionals. The current trajectory is unsustainable and demands immediate, decisive action from the government. The continued escalation of alcohol-related deaths cannot be accepted as the status quo. A fundamental shift in governmental approach is crucial, prioritizing alcohol harm reduction as a top public health concern." The call for comprehensive and effective intervention strategies is not merely a recommendation. It is a critical necessity to prevent further preventable loss of life and mitigate the devastating consequences of excessive alcohol consumption on individuals, families, and communities across the UK. The time for decisive action is now. The consequences of inaction are simply too dire to ignore. A multifaceted approach, encompassing public health campaigns, educational initiatives, increased access to support services, and robust regulatory measures like minimum unit pricing, is essential to stem the tide of this escalating public health crisis. The lives of countless individuals depend on the government's immediate and decisive commitment to tackling this urgent issue.